Hi, I am Dr. Anantha Krishna. I am a practicing surgical gastroenterologist at Nano Hospitals, Uttarahalli. So when we come to the topic of reflux disease, so most of us would have experienced some form of heartburn, some form of discomfort after we have had a heavy meal. So what is this reflux disease? So normally the food is supposed to go from our food pipe into the stomach. Sometimes because of a heavy meal or because of an anatomical problem wherein the valve between the food pipe and the stomach is abnormal, there will be a backflow of food and the stomach contents into the esophagus. So this is called as reflux disease. So main problems with this reflux disease is we feel some form of heaviness in our chest. We can feel sometimes a heartburn, or sometimes we may need to induce vomiting to get rid of these symptoms. So the main reason for this reflux disease is what we call as the lax esophageal sphincter. So in this disease, there will be the sphincter that is connecting the food pipe and the stomach will be loose, which will allow backflow of the food from the stomach into the esophagus. So many times this is associated with what we call as a hiatus hernia. So a hiatus hernia is wherein the anatomical structure that is supposed to be there inside the abdomen is coming back onto the food pipe. So this causes a increased reflux of the food contents from the stomach into the esophagus. So this is seen more commonly in patients who are obese, and it is also seen more commonly in patients who smoke a lot, who have untimely meals, and who have late meals and heavy meals. So these are the things that we need to avoid, or these are the preventable causes of a reflux disease. So when it comes to surgical treatment for this reflux disease, we might have to correct this valve that is loose by doing a small surgery called as a laparoscopic fundoplication, which will correct a hernia as well as correct the valve that is connecting the food pipe and the stomach. So before attempting for surgical treatment, we initially have to give a trial of medicines, and only when the patients are responding partially to the medicines, that is when the surgery will also help these patients.